In honor of WI-AIMH's 20th anniversary, I had a great luck to visit with Therese Ehlers, the founding executive director of the Wisconsin Alliance for Infant Mental Health. And I thought it might be fun to ask Therese a couple of questions about her view on the evolution of the agency. So here we are.
It's such a delight to see you, Lana. It's been so long. I think
I,
it's been since before the pandemic.
it's been way too long.
I know.
So, Teresi, tell us, what do you see as WI-AIMH's top accomplishments?
There's so many, it's hard to say, but one of the things that I'm very, very proud of is that we've really increased the awareness of the critical importance of social emotional well-being, of the critical nature of infant and early childhood mental health, and how it is the foundation of all future development. It's the cornerstone upon which all healthy development lies. I also think another accomplishment is that we have a ways to go, but we really have a great start in integrating infant mental health practices into all child serving systems, such as child care and child welfare, home visiting. The list goes on.
Thank you. What makes you most proud of the agency that you started 20 years ago and that Donna Harris and Jim Ryan dreamt of and really established?
Well, that's another hard question. You're asking a lot of hard questions, Lana. Of course, that I wouldn't expect anything less of you. Um, what I am proud of is that WI-AIM is still evolving. That WI-AIM isn't an organization that's stuck and that just does the same thing over and over. That we continue to meet the needs of early childhood professionals who in turn are working to meet the needs of young children and their parents. For example, with COVID, WI-AIM's work did not stop, but the agency pivoted. The other thing that I was so proud of is how WI-AIM really took on racial equity and made it a focus of their work, given the difficult times that we are and how various different situations brought out such sadness in our country. So thank you, Lana. I know that this was done under your leadership, and I'm very proud.
Thank you. Thank you. What about us in 10, 20 years? Where do you see WI-AIM going in 10, 20 years from now?
In 10 or 20 years, I see the agency continuing to evolve, continuing to change, continuing to be on the cutting edge. Whatever science says, that you'll continue to do what is needed. I see WI-AIM continuing to push the envelope. For instance, getting Medicaid to recognize DC 0 to 5 and to support children getting medically necessary interventions in a timely manner, that we shouldn't have to fight to get kiddos and parents what they need.
So, what are your biggest hopes for WI-AIM?
So, what are my biggest hopes for WI-AIM? You know, one of my biggest hopes for WI-AIM is that everyone, whoever you are, whether you're the neighbor, an early childhood professional, a policymaker, that you know how important those early years are and how important social emotional development is. I have this enduring hope and desire that all state agencies support WI-AIM to ensure that all who touch the life of a child know how to support the social emotional development, and that kids that need help and that are struggling with mental health issues along with their parents receive the help. Another hope that I have is that the system becomes less fragmented, that the system becomes more unified, and they work together on behalf of all infants, young children, and their parents.
Beautiful. If you could go back in time and share wisdom with yourself as the new director at a new agency that was 20 years ago, what would you say to yourself?
Geez, what would I say to myself? If only I knew now what I knew then, huh? But anyway, I would suggest taking one day at a time, that you have a plan. Don't put too much on your plate. Have a plan, but be ready to change the plan based upon when different opportunities may arise. Also, develop your relationships. You know, relationships are a key to this work. You know, figure out, um, you know, who's in your corner, who understands it, who drank the Kool-Aid, and develop those relationships. I think that's key.
Beautiful. If WI-AIM had to have a mascot, what would it be?
Well, of course, I want to say Bucky Badger, but Bucky Badger is already taken as a mascot. So I was thinking maybe a rattle, but I'm not so sure about a rattle. What I think I like the idea of is a kid's mobile. You
Mm-hmm.
know how a kid's mobile, it's always moving, it's always changing, it's pivoting, just like Wisconsin Alliance for Infant Mental Health.
That's beautiful. Um, what is WI-AIM's legacy in your opinion?
WI-AIM's legacy. I think the message and the legacy that WI-AIM continually strives is that babies can't wait. Babies can't wait because the time is now. I want to, I read a little thing that Irvin Harris said, and I don't have it in front of me, so I'm not going to get it word for word, but it went something like this, that you know, the early days and weeks and months of a child's life, it's not a dress rehearsal. It's critical. This is the real thing. And what we do during that time has profound effects for a lifetime. Another quote I really like, and again, I probably am not quoting word for word, is something that Warren Buffett said. And what I like about this is what Warren Buffett said is that all kids are born equal, at least the first 30 minutes. And I think that's telling. That's telling. So, you know, WI-AIM, I think, is on the right track. I think WI-AIM has done fabulous work, and I can't wait for the next 10 to 20 years.
Beautiful. Thank you so much. And I'm very hopeful that next year we have to have a big party to celebrate.